All right, we're back for another episode in the concussion series. And in this one, what I wanted to discuss is some of the more common misconceptions surrounding concussion that I hear on a pretty regular basis. So, my name is Dr. Matthew Shim. I am the owner of Peak Brain Performance Centers located here in beautiful Colorado Springs. And basically, what we're going to be doing today is taking the top 5 topics that I hear pretty regularly, and we're just going to break down each individual one. So, we'll take one topic, dig into the literature, see what it says, present the findings. And so, obviously, none of this is my own opinion. If you look in the bottom left-hand corner of every slide, you'll see that each one is referenced, so you know where I'm pulling this data from. And I'm just going to present you with the findings, and then we can all form our own opinions after that. So number one is that you have to lose consciousness in order to sustain a concussion. And so I have people that come to my office all the time that say, I'm dealing with X, Y, and Z, and for sure, I didn't have a concussion, right? Because I never lost consciousness. And in reality, less than 10% of people who sustain a concussion actually lost consciousness, okay? And if you look at the way the traumatic brain injury is graded, there's 3 different grades, okay? So you have grade 1, 2, and 3, mild, moderate, and severe. And concussion in itself falls more in the category of mild traumatic brain injury. And mild traumatic brain injury is defined as an individual who is hit, they're now experiencing some symptoms, but they never actually lost consciousness. It's not till you get to a moderate traumatic brain injury where you start dabbling in the loss of consciousness game. And depending on the reference that you're looking at, some will say that it's just a brief loss of consciousness, and some will say that you never actually lost consciousness at all. It's not till you get to a severe traumatic brain injury where you definitely lost consciousness, and some even say it's a minimum of 5 minutes that you were out. So number 2 is that you have to get hit in the head in order to sustain a concussion. And if you just look at the definition of concussion, concussion is defined as a brain injury induced by either a direct or indirect biomechanical force that's transmitted to the head. So just in the definition alone, we know that you don't have to get hit in the head in order to sustain a concussion. All it has to be is a force that's transmitted to the head. So whether I'm hit in the body and that force is transmitted to the head and it rocks my skull a little bit, or when you work with a lot of veterans, you see a lot of people who are involved in combat and they're involved in blast injuries where they could be a good distance away from wherever that blast occurred, but the blast then sends sound waves through the air that cause this perturbation of the head leading to concussion-like symptoms. Number 3 is that helmets prevent concussions. And in this study, what they came to the conclusion is that helmeted patients did not have any better relative clinical outcome and protection against concussion than unhelmeted patients. And there's a really cool video. There's a TED Talk entitled "Why Helmets Don't Prevent Concussions." And basically in this video, what they did is they took some football players at the University of Stanford and they gave them this fancy mouthpiece that has like accelerometers and stuff in there so they could get some data of whenever these individuals were hitting each other. And then they did some scans on their brains as well. And what they found was, if you remember back in a couple lectures ago, we talked about how the brain in itself, when it sits inside of the skull, there's a little bit of space that it can move around in there, right? And so whenever I go forward to hit my head, it doesn't just hit and then rock and then hit the back. What it does is it hits and then causes a little bit of rotation and torsion. And just like if I have a wet towel, if I wring out a wet towel, the center part of that towel undergoes the most amount of stress. So same thing happens with your brain. And what they showed in this imaging was that the center part of this brain goes up to what they called 50% stretch of these neurons. Were getting 50% stretch in the center part of the brain. So basically, by putting some helmet over your brain, over your skull, you're not decreasing the amount of space that's inside of the skull, leading to the brain that can still move around. So you're not actually preventing concussion in any manner. All that you're really doing is preventing any traumatic brain or traumatic skull injury and fractures of the skull or anything like that. So while important, not preventative. Number 4, and something that really grinds my gears, that a lot of providers are saying even today, is that, you had a concussion, what do you do now? Just go rest until your symptoms go away. And while that may happen for some people, that your symptoms may subside after, a couple of weeks or maybe even months, you're not actually recovering from your concussion. You're just compensating. And we'll do a whole nother video on that and what that means. But in this study, what they did is they took 88 individuals who had recently sustained a concussion that presented to the ER. They presented to the ER within 24 hours after concussion. And in these 88 people, they split them into 2 groups. So in one group, they had people who were prescribed 5 days of strict rest, and another group who was prescribed what they deemed usual care. And what they call usual care is 1 to 2 days of rest, and then they follow up into a return to play rehabilitation program. And what they found was that the individuals that were prescribed strict rest for 5 days, they reported more daily post-concussive symptoms, and they recovered slower. Their recovery time took much longer than the other people. So moral of the story is, if I want to get back out on the field as soon as I can, or I want to get back to my job, or be able to play with my kids, or just get rid of these symptoms that I'm having after I hit my head, the key is, let's start rehab as soon as I can to be able to get back to where I want to be, okay? Better, sooner is always better. And the last one is that I sustained a concussion, or I sustained some sort of head injury, and now I guess I'm just going to deal with this. This is my new normal. So I see people that come into my office all the time who, they say, they stand up, they get a little bit lightheaded, they say, oh, I just stood up kind of fast. That's kind of normal. That's not normal. Or, and this is a true story. I had a gentleman who he had migraines every day for 40 years, and he said that whenever he was playing golf, whenever he played golf every single day, and in order for him to make it through 18 holes of golf, he had to do 2 nasal steroid injections. And he had classified this as his new normal. He'd been doing this for years. And so if we just look back at the definition of concussion again, concussion is a brain injury induced by direct or indirect biomechanical force transmitted to the skull, transmitted to the head, but it results in a reversible clinical syndrome, right? So that's the important part, is a concussion is in most times reversible. So while we may not be able to always be able to cure every single aspect of it, there's always progress to be made. And no matter if it was a head injury that happened yesterday, or even in this case where this gentleman had been struggling for 4 years, there's always progress to be made. So I think that just ties into what I kind of want to get across in every single one of these videos, is trying your best whenever you do have a head injury to find the most qualified provider that's going to look at you through a unique lens and be able to prescribe you a unique treatment plan for you and your brain injury, and not just some one-size-fits-all brain injury program that he gives every single patient and then hopes for the best. So I hope you're able to learn something today. I hope you enjoyed it. If you want to get in contact with me, you can email me or phone me. My information is on the screen there. Other than that, I hope you have a great day, and I'll see you in the next one.